The knowledge base of what we do in medicine needs to have advanced to the point where you understand what a cell secretes, how cells communicate, and what growth factors are, and what an exosome is, and the different types of things. The medical industry as a whole, and in particular, I think Big Pharma, realized very early on that cell therapy was the way the human body works, and they had to get ahead of the narrative before the science of using your cells to help you heal got kind of out of control. And we're back. I'm Dr. Wade McKenna, and we're with the Zero Downside podcast, as always, sponsored by MOABTexas.com. Why are we here today? This is a little bit different setting than normally. We're a little out of the studio. Today we're in the clinic. This is my favorite place. This is my happy place. It's my absolute drug of choice. And I think anyone that knows me very well knows that for sure. What about the machines behind me? Well, as most people know now, on the peptide side, we've been really involved on the peptide management to wellness for a lot of our patients. The bone marrow aspirate, stem cell, taking care of orthopedic injuries, getting people out of metabolic failure with a painful joint where you gain 50 pounds after joint surgery. I can grow cartilage in your knee back, but how do I get you healthy after that? And if you've had pain and been chronically injured, you're not functioning right. And most of the peptides were a way to kind of cheat the scale in your favor, help you get healthy again. That's our real goal. The weight loss part of it with some of the peptides, especially a modified version of tirzepatide where you can add an RA modifier, makes it incredibly more efficient, where we can manage muscle mass with peptides that help the growth hormone secretagogues, ipamorelin, CJC, sermorelin, tesamorelin, coming up with custom peptide blends to help you maintain muscle mass. It's mostly about just trying to be healthy. Anyone that's seen me over the last 4 or 5 years knows there's been a pretty significant journey that was basically motivated by the fact that I'm a single father to 3 kids and they're all beautiful women. And I started caring more about being around for them. But after you start losing weight, after I got fit, after I was not metabolically in a ditch anymore, you're left with a lot of failed skin. A lot of people, I didn't lose 110 pounds to look older and worse. You lose 110 pounds, number one, I wanted to feel better. My knees hurt all the time, over 280. Under 280, my knees didn't bother me so much. I had 5 surgeries in one, 3 on the other. Every time I'd get too active or every time I get too heavy, or if I even wore cowboy boots, like I would change after church. If the kids wanted to go shopping, I had to put tennis shoes on. Knees would hurt too much. Under 280, a lot more exercise tolerant. I could stand the weight bearing. It wasn't metabolic failure. I didn't hurt. But after losing 100 pounds, skin sags a little bit. You have all this redundant tissue. And even though I'm a fellowship trained orthopedic trauma surgeon, still not the biggest fan of a lot of aesthetic surgeries for me. It just wasn't the right route because I don't trust the system. And for the most part, the body can do a lot. Cellular autophagy, the shrinking up of tissue, the restoring of the subcutaneous health, getting that glow back with some peptide management, all that subcutaneous blood supply and health and hair and skin, all of those things still left me with a little bit of saggy skin and a little bit of looking a little older. To help patients, especially because a lot of our patients have lost in excess of 50 pounds. And if you lose 50 pounds, then I have to help you get some muscle mass back because it's not about the number on the scale. It's about your body fat percentage. It's about your muscle mass. It's about your energy level. It's about your clarity of thought. It's about your energy. Mental clarity, energy, muscle mass, that doesn't all just magically come back by losing weight. There's still a lot other pieces to the puzzle. But how can I help people solve some of those? Energy, easy. NAD+, clean up your mitochondria. Even with the GLP-1s, and I'm going to stay away from calling it the GLP-1s because I'm not a big fan of semaglutide. It's basically an appetite suppressant. It shuts down some of the food noise, but in our practice, we don't use a lot because everyone got sick. Our ability to keep people on semaglutide for longer than a couple of months was less than 40%. That, I can't help you a lot if I can only treat you for a month. With tirzepatide, especially when you add an RA modifying peptide and with some proprietary formulations on that, all of a sudden you weren't suffering the food noise. I can get you burning some fat. And it's uncommon in our practice. If someone has more than 50 pounds to lose, we still start with a lot of tirzepatide and we dose you up to an effective dose. Our goal in the clinic and our peptide thought is about minimal effective dose. I don't control your dose, you do. You have a bottle of peptide, we help you, we've given you instructions. That's the other side of this. Most of the time if you're buying peptides on the internet, what you can't have is physician direction. I don't want to get your peptides out of your gym bag. This doesn't need to be a gym bro kind of program. It needs to be medically directed by someone that knows how to do it, that's been doing it for a long time, and has also had some pretty amazing results on me, my family, all the people in our clinic, and thousands of patients now. So that skin tightening, what's the way to help you with that? As it turns out, there's a lot of tools out there, and my goal has always been to be the guy that has the coolest toys, right? And skin shrinkage using RF and ultrasound and radio frequency together, ultrasound and radio frequency together with magnetic stimulation for return of muscle mass. Like EMSCULPT and EMSCULPT Neo, you do 4 treatments once a week or twice a week for 2 weeks. And after that 4th treatment, you go out 10 weeks. If we're treating abs, that's the metabolic direct equivalent of more than 100 setups a day for a year. I didn't have a year to do 100 setups a day. Number one, after 5 back surgeries, working on abs is incredibly painful because it might mean I can't go to work the next day. Like I would go to the gym, but it was more important for me to be able to go to work. And doing a bunch of abdominal exercises may made it where I couldn't do that. So I was limited in my recovery. EMSCULPT changed that. 4 sessions of EMSCULPT, start feeling pretty good on abs. Pretty life-changing because guess what the best way to protect your back is? Strong core. What do you have the most trouble doing after back surgery? Developing a strong core, because all the exercises that can give you your core back made me hurt, put me in an inflammatory overload. I'd suffer from the repercussions of the workout and may not be able to be functional next day. It's more about avoiding pain. So what happened is I would have to change my activity levels, modify my lifestyle, and it was hampering my overall recovery of muscle mass. EMSCULPT changed that for me. EMSCULPT Neo now, to be able to modulate the health of a muscle with ultrasound and radio frequency more than just direct mechanical stimulation with the muscle. Here's the thing, even with EMSCULPT, when you do muscle stimulation with a magnet, it's 1,000 times stronger than Russian E-stem. So the traditional E-stem, all the little pads out there, those work. They're not very efficient. They're not 4 treatments. It's months to see a little bit of a result. But with a direct mechanical stimulation of the muscle, that's 1,000 times stronger than sticking a wire in the end of both muscles and directly stimulating it. Now we've upped the ante. Now you get to see direct results. Now I'm not talking to you about some treatment that you're not going to notice a difference. It's incredibly difficult to stay fit and on point if you're not seeing a result. That's the problem. It's not that you're not motivated. It's not, we've blamed everything on the patient forever in Western medicine. It's your fault. It's about calories in, calories out. Myth. It's not. And everyone knows that. Look, everyone in their mind has a friend that eats whatever they want and they still look great. Everyone that's been on a weight loss journey knows there are times where you starve yourself and the scale never changed and you weren't burning fat. Insulin resistance is real. That's how the GLP-1s work, especially with the GIP, using tirzepatide and with retatrutide. So if you lose 20 pounds with semaglutide, 10 of it was muscle. That's a backward step. Muscle is the currency of aging. This is about restoring muscle health. The GLP-1s, the other peptide formulas, the growth hormone secretagogues, the anti-inflammatory components, just BPC, anything that pulls you out of an inflammatory load makes it where you're not burning muscle. Insulin resistance means if there's a little insulin floating around your system, you're never gonna burn fat. That's insulin's job. It's keeping you from burning fat. We correct that, but how do I make you strong? Like the biggest example in our clinic early on, the very first foray into muscle stimulation for us was we'd have some lady, older, and we'd be trying to save her knees. And so we have a really cool technology called cool leaf and nerve ablation. So I can take a bone-on-bone knee and in 15 minutes with you asleep, make it where your knee doesn't hurt at all for 2 years. Like it's dramatic because you're ablating with radio frequency the sensory fibers to the bone. It doesn't make you more at risk of hurting yourself. It makes it easier to get active because the pain of the knee was getting in the way. I didn't have to grow cartilage to make the pain go away. But what about those people? They'd come into me for cells, we'd put bone marrow in. What's published with bone marrow aspirate concentrate is on average 20% restoration of cartilage at 6 months. That's really well reported. There's a ton of studies that for cartilaginous preservation and restoration, bone marrow aspirate cells work really well. But if I get the cartilage in your knee better and you'd been weak for so long in your quads, I'd send you to therapy. You'd get in therapy, they'd have you doing something wrong, you'd be, and all of a sudden they're screwing up all this stuff I'd done and worked so hard to make you pain-free. Nerve ablation, that procedure, I can ablate the nerve and then add EMSCULPT, and I could get you about 20% more muscle strength in a period of 4 treatments. Well, that's the difference between standing up and down out of a chair by yourself. That's independence. Independence is the ability to get up and down out of a chair by yourself. If you don't have the quad strength to do that, it doesn't matter how pretty your knee is on x-ray. Well, my knee doesn't hurt anymore, but my legs are so weak, I can't even get up and down out of a chair by myself. I can lay you on a table, stimulate your muscle, and usually within a couple treatments, restore the strength of independence and function. Now with EMSCULPT Neo, you can treat the muscle at a metabolic level. Now with Exion, we can shrink the subcollagen tissue, still keep your collagen health. It's not burning all the collagen out of your system. It's reformatting type 2, type 1 collagen and shrinking the tissue down to where you don't have all that excess skin, where you have tighter fit muscle mass. Just know that as you lose all your weight, you don't have to look bad. It's not about, for me, it wasn't about how I look in my clothes. Although I will tell you, it's a dramatic benefit to be able to wear a 32-inch pant and actually fit in a plane seat feels pretty good, but it didn't feel great to have a bunch of saggy skin everywhere. Exion, radio frequency, ultrasound, the shrinkage of that extra tissue, it's helped me avoid the way it feels when you take off your shirt. It's helped me avoid hanging out in a plastic surgery office with a bunch of lipo or a bunch of skin tightening stuff. I'm just not, first of all, I'm a guy. Like I have 3 daughters. I get that there's some need. It wasn't about how I felt when I looked in the mirror. It was about how did I feel? Well, how you feel with a bunch of saggy skin is not great. How you feel after you tighten it up, get some muscle mass, get a little bit of ab where you can actually have a little bit of tone. I didn't do all that in the gym. My daughters, they do it right. I'm in the gym a little-ish, but for the most part, it's about laying on a table and get it to where now, can I tolerate a workout now without hurting my back? Yes. Could I have done it before some EMSCULPT, even after I lost all the weight? No. Losing weight actually, most of the time, subtracts from your muscle mass. That's not our goal. Our goal is to give you healthy, lean muscle, keep you fit, get you metabolically sound so that you can be on point. It's about energy, mental clarity, the way you feel. All I really want for people is, and the reason we have all these toys in the clinic between EMSCULPT, EMSCELLA, Exion, ExoMind, it's all about, I just want you to be your best you. So if this is you, if this is where you're at, 2026, my staff understands the terms new year, new me. We went through that a few years ago with us. Now it's time for us to help you. Please give us a call, hit the link below, turn on your notifications. Thank you for your attention. And as always, you're the reason we do this. My passion for your results is what fuels our passion for what we do. Thank you so much for your attention.